We're turning the floor over to Donald.
Okay, can we go to the next slide, please? The next one. So I'm the co-founder and director of Black Wall Street. I experienced addiction for over 23 years, so this hits close to home. This is Black Wall Street. We have 7 different Narcan locations throughout the city, where we keep them supplied with Narcan nasal spray. And here we are at the university to bring Black awareness to combat it in the African community. A lot of us don't know that we're suffering from these opiates because it's not in a needle form, but it is in pills and also in syrup that we choose to drink and partake in. So we have to bring the awareness to the Black African American community that it is affecting us, and that's how we're dying and overdosing. Next slide. Here's the overdose prevention and Narcan education that we put together. We gathered data identifying the red zone. One of our red zone is the Diamonds Casino, where we have 2 boxes of Narcan. And what that looks like is old newspaper stands that we have painted over, put our logo, and teamed up with Wake Up Nevada, and keep it supplied through cassette UNR for those nasal Narcan sprays. We also take these measures inside the schools, educating teachers and students of the Narcan kits. A lot of the students know what they are. A few of the teachers know what they are, but we bring them into the schools and teach them what we know about it. We also host Stop the Bleed class, where we bring a firefighter in, and she hosts us for about 8 hours of class where she teaches how to stop the bleed. As you see on the news, there's a lot of shootings. There's a lot of unexperienced teachers and students that know how to actually stop the bleed. It's not the gunfire that kills them, it's the bleed out. We also have a youth team that we have teach as evidence-based training and recovery classes in the schools. And what that look like is that we take the students from Innovational High School. We have them every Wednesday out of the month, every Wednesday. So for a month, we have them in the school twice. We have evidence-based training where they are taught suicide prevention, overdose, stop the bleed. And the last week of the month, we have a mental health day where we take them to UNR for engineer college to tour, or we take them for a nature walk just to let them overlook what they've been through for the month, what they learn, and how to apply it throughout the rest of their lives. Next slide, please. So here's Black Wall Street at the schools for Narcan training. That is me on the left teaching the kids how to do first respond calls for the 911 emergency. Also the 899, I believe, is the call for mental health. That is Romar, the co-founder and director of Black Wall Street, teaching overdose awareness at Lemon Valley. And here's the teen recovery classes, my daughter and myself, in which we teach the kids about suicide prevention, where we, in the background of the pictures, where we take them up to Project Discovery. We team up with Carrie from Forever 14, and we took about 100 students last summer. We're looking to do the same this summer. Next slide. So this is spreading the awareness and combating the opiate crisis within the African community. The indigenous youth involves the juvenile justice system and criminal justice system. We're kind of looking to, I know when I used to get arrested for possession, I would get the same charges if I was selling it. So we're trying to get that understanding of what's happening. We're trying to pass that information that it should be a little bit of a different charge. And like I said at first, that the Black community don't know that they're struck by it. Back in the 80s and 90s, crack epidemic, you've seen all the Black pictures of all the Black families. You don't see that when it hits the opiates. So we don't think that it applies to us because our faces are not seen on that. So we continue to slip into comas and overdose off these pills. Next slide. What's working well? Evidence-based training. And here is the one-on-one health training in the schools to elevate the issues of self-care related to behavior health and substance use before the problem occurs. We noticed that we are asking the question of how to help them 18 years too late. when we should start in middle schools and elementaries addressing those issues that is keeping them trapped in their environment. We also noticed that the first oak boxes were too small, they were getting stolen. So we came up with the idea of the newspaper stand. However, we are unable to keep track of individuals who are actually taking it. We don't know if one individual is taking all of it. All we know is the numbers that we ordered. So we kind of want to model the track B vending machine here in Reno. As we said, we teamed up with Dorsey Patterson, but it seemed like a lot of people, but there's only 3 of us that's trying to keep these 7 locations filled. And once Cassat runs out of Narcan, we're on a standstill. There's nobody out there doing the boots to the ground that are meeting the people where they're at besides Black Wall Street and Wake Up Nevada. Next slide. The engagement billboards is what I said about indigenous people. You don't see our faces there. The lack of program and funding, they see what Black Wall Street and Wake Up Nevada is doing. We do this from our heart, but at the same time, we do need to provide for our family. We do need more funding to make sure that these vending machines can be placed in those red zones. We also would like to know the feedback of the decrease in 911 calls in the areas that we are patrolling, basically, to see if what we're doing is actually working. We know we are because we receive letters in the Narcan boxes explaining how their lives have been saved and what great jobs are we doing, but we cannot get grants moving forward without those numbers. And that is the lack of opportunity and diversity in the happens. Next slide, please. We would like to organize reaching indigenous community members. Hey, Darcy. So the track B model with finding for the staff, for funding for the staff, that goes back to the funding for the track B for the models that we need to keep the data coming in. And also is the address the school to prison pipeline. That is the new Jim Crow that we have. That is a book that we see that what is happening with our youth is it's too late. We're actually at the age of elementary and middle school, they have the potential to be a doctor or lawyer. By the time they get into high school, they're pimps and pushers. So it's not how to destroy the young Black male or female man or woman, is how to destroy them as the youth. And that's what we need to go in there to destroy the prisoner pipeline. And that's what Black Wall Street, Wake Up Nevada, and Victory Outreach have developed that program to go into the schools and bring that evidence-based training and understanding to the youth, where they can speak out and have an understanding without being under any scrutiny from their parents or teachers. It's a peer-to-peer group setting. Next slide, please. And the reference is the Michelle Alexander, the new Jim Crow, the mass incarceration of Black people. It's just a new way of arresting. The war on drugs wasn't the war on drugs, it was a war on people. And that is a book that we do reference throughout our studies and evidence-based training. Next slide. And here's my contact information. I didn't know how many minutes I had, so I kind of sped through that. Next slide, if there is one. Nope, that's it. So if there's any questions, if I left any time.
Thank you so much, Donald. Subcommittee members, do you have any questions for Mr. Griffin?
Hi, this is Steve Shell. I don't have a question for Mr. Griffin, but I wanted to say, Mr. Griffin, that I wanted to commend you for all of your efforts. You're doing phenomenal work. So thank you.
Thank you.
Well, you know, I have questions. Donald, thank you so much for everything you're doing out there. I did have a question. One, indigenous means a certain thing, so I would love to hear more about the use of language around indigenous African American.
Yeah, because we noticed that Black doesn't mean anything. We're the only ones that's checking off the content as Black, and we have noticed doing paperwork and cross studies that everybody else is checking off white. I believe that we're the only one that's playing the Black game. Even when Africans come over here, they're not putting African Americans, they're putting either Ethiopian, and then under that they're white. So I believe that taking the stigma of just being Black in an empty vessel. So we do believe that we were already here. We are the indigenous people here. We know that it was almost impossible to transfer that many slaves here. So we said we are the indigenous people. We have been here. We have been raped of knowledge and of perseverance. We don't know where we come from. So we have to start back as being the indigenous, is the first people who here to have a new start.
Thank you so much. That makes sense. My second question is, excuse me, I have something in my throat. My second question is around the vending machines. I know that there are 4, maybe Chelsea could answer this a little bit better than me, but I think at our last Northern Nevada Harm Reduction Alliance meeting, there were 4 in town of those vending machines. We try to be really use data to inform where those would be located based on non-fatal emergency EMS data and based on overdose deaths, right? We know that there are targeted areas, and it's interesting because those also map onto free and reduced lunch in schools, and it also maps on to where CPS does a lot of removals. And so according to census data, those tend to be high poverty, especially childhood poverty areas. So everything is kind of like, I think the target is poverty, right? Poverty is a risk factor, but it's interesting because those vending machines will be placed. I think they're already here. They just need to be filled, was my understanding. In fact, John Saderlin was taking the video call in front of the new vending machine. So there's one at the county sheriff's office. There's one at the Life Change Center. Chelsea, do you know where the other ones are? If BHG took one?
I think BHG does have one, but I'm not 100% sure. No, I don't know where the other 2 are exactly.
So if that's something you're interested in, I would urge you to talk to Track B that already kind of has that infrastructure in place, and get a vending machine up at Black Wall Street, especially like you're right there. I went to school right across the street at Vaughn. And I can tell you that's when my substance use escalated, as in middle school, starting in elementary school, which is again right down the street from Black Wall Street at Roger Corbett. So that area is hot, as far as especially youth and adolescents using drugs. I'm sure that wasn't just in my time that was happening, right? So anyway, I would encourage you to have those conversations, and any other subcommittee members have questions for Mr. Griffin? I always want to give power to the pause, just in case, people are thinking. But I am not seeing anybody coming off mute. So thank you so much, Donald, for being here and for all you do for our community.
Thank you. Enjoy your day.
You too. All right. Moving on to agenda item number 5. It's another presentation, and this is with Sean O'Donnell from Foundation for Recovery, a presentation on role and importance of peers and persons with lived experience. I will turn it over to you, Sean.
All right, thank you, Lisa. Good afternoon, everyone. For the record, my name is Sean O'Donnell. I'm the Executive Director of Foundation for Recovery. I'm a person living in long-term recovery from substance use and co-occurring disorders. We could go to the next slide. So originally, I believe I was asked to come on and just do a really quick presentation on who peer recovery support specialists are, what is peer recovery support, and look at some best practices for integration for other agencies that may be interested in peer recovery support services. So we could go on to the next slide. And we could actually just, if whoever's controlling, just click the mouse, and then all the points come up, the bulleted points, and then I could kind of go through them. All right, so for the purpose of this slide, we're going to start by just talking about the role of, talking about what peer recovery support is. And then we'll start to look at the actual role of a peer recovery support specialist. So in regards to peer support is evidence-based. It's been around since at least the 18th century. It's been well studied. There have been numerous studies that have been published on peer recovery support and its efficacy. And in a letter dated August 15th, 2007, CMS actually came out and said that this is an evidence-based practice. Peer support is always person-centered and voluntary. So what does that mean? That means that we walk side by side people. We don't direct their path, but we listen, we validate their experiences, and we share relevant parts of our own journey to recovery and wellness with our peers. Peer support is also non-clinical. So while peer support complements clinical approaches, it's not clinical in nature. Peer workers do not focus necessarily on the pathology or the diagnosis. Peer workers help people to discover and build on what's working for them, even while they may be in the midst of an illness. Authentic peer support uses a strengths-based perspective to build on people's resiliencies and capacities, rather than providing services focused primarily on correcting their deficits, disabilities, or problems. And like all mental health and addiction workers, peer supporters are committed to helping people move beyond illness. Peer support is also always based on authentic connection and social support. And so that looks like relating to one another's shared life experiences. As we talked about, it's reciprocal. So that means that both the peer worker and the peer are getting something out of this relationship. They're supporting one another. It also limits the power differential. So what that means is, in other types of maybe behavioral health environments, or even in like a teacher-student type of relationship, there is inherently a power differential that exists. So with peer support, we always want to try to limit that power differential as much as possible between like the helper and the helpee relationship. It may be also formal or informal. So it could be provided as a service by a trained peer recovery support specialist, or found in the community through a variety of natural supports and mutual aid networks. So when we think of peer support as a service, we're typically referring to this formal peer support, which is likely most applicable to the context of the conversation today, where an individual has personal lived experience and they have been provided training, they are working towards, or they have achieved like state certification, and they're working with an agency providing peer support as a service. So that's formal peer support. It may be found in a variety of settings as well, like crisis response teams, jails, warm lines, syringe service programs, overdose prevention sites, treatment and detox facilities, schools and colleges, recovery residencies, and community recovery centers. We can go on to the next slide. All right, so now let's take a closer look at the role of a peer recovery support specialist, the individuals who are providing this peer support. So it is provided by individuals with lived or living experience who provide mentorship, resources, motivation, and guidance to others. They have experiential knowledge, which requires wisdom gained about the problem from a close-up firsthand perspective versus secondhand knowledge or something that could be learned. Peer recovery support specialist usually works with individuals, we call them their peers, to identify goals, needs, and barriers to their recovery. They may help their peers with something we call health activation. So helping to motivate their peers to re-engage in their own personal health or other health services. So this might look like just having conversations around safer drug use. This could look like having conversations around fears that their peers may have with engaging with a primary health doctor or with a treatment care team or going to detox. In fact, one New York City study found that 60% of people who inject drugs said that they avoided medical care because of the stigma that they were afraid they were going to receive by medical professionals. So peer support as an integrated service can really help to have conversations around those fears, because many of us have also experienced that at one point in our lives. So we'll look at some common activities of these peer recovery support specialists in the next slide. But it's important to know that in the state of Nevada, anyone who is providing peer recovery support services for compensation must obtain state certification through the Nevada Certification Board. And there may be varying titles for people that are doing this type of work. So we've seen things like recovery coach, peer worker, peer recovery support specialist, peer advocate, and the list kind of goes on from there. We could go on to the next slide. So let's take a look at the role of a peer recovery support specialist. So here are some general competencies, things that a peer should be doing versus tasks that don't necessarily align with what peer workers should be doing. And this is really important because we have found that, educating other agencies on this is really key, because an agency may think that they have a bunch of peer recovery support specialists employed, but really they're having those individuals doing like case management services, general administrative tasks, or like driving the facility van. So here's a quick list. Some things that peers could do are like running peer-led support groups like WHAM groups, Smart Recovery, All Recovery meetings, harm reduction works, other types of groups, offering support, filling out paperwork for the work that they do, creating a recovery plan, teaching self-care and activation tools, using language based on common experiences, and sharing knowledge of local resources. Things that they shouldn't be doing are running a therapy group, offering therapy or counseling, acting as administrative support for the facility, creating a treatment plan, doing things like counting pills, taking UAs, searching living quarters for illegal substances, or primarily just driving the facility van, using clinical language, or providing strictly case management services. And we could go on to the next slide. I think that we have a quick video that summarizes everything that we've talked about so far.
Most people understand traditional methods for substance use recovery, but peer recovery support as a service can be difficult to grasp. Peer recovery support occurs when people with shared lived experience connect with each other. The bond that results can create mutual empathetic experiences that foster growth and recovery. Evidence is growing that peer support services help nourish the seeds of recovery and cultivate marked improvement for individuals and the healthcare system. This person-centered, voluntary approach to recovery can support people in building self-confidence, increasing healthy behaviors, and building meaning in the lives of people affected by substance use challenges. Peer recovery support takes many forms. It might look like working as a behavioral health professional, or it could look like two friends visiting together in a coffee shop. When peer recovery support is used as a service for people navigating substance use, a person with lived experience undergoes training to support others in building meaningful lives. Peer workers share their stories of recovery to inspire hope, connect others to community resources, support people in learning skills, advocate with people in recovery, and sometimes lead recovery groups. Peer recovery support services often occur in community settings where the people seeking support live and work. They also play a vital role in engaging individuals who have historically been denied access to services by providing information about alternative support options. Peer recovery support professionals can also be found in institutional settings like hospitals, treatment centers, or jails and prisons, where they add value to an individual's recovery journey. Whether it's finding a job, developing a skill, or grabbing a bite to eat, peer recovery support services make recovery more accessible by helping individuals foster lives where recovery can thrive and bloom. To learn more about available resources and how peer support can help you cultivate your recovery, visit the Peer Recovery Center of Excellence.
All right, and we can go on to the next slide. So in that video, we saw examples of this formal, informal peer support. We also heard, the language around person-centered, voluntary. So that is a great summary of what a peer recovery support specialist does and what these services are. So here's a quick slide on some values of peer recovery support services and some considerations for agencies looking to integrate peers. So we'll start with some examples of other programs. In a study which surveyed a group of over 1,000 people in recovery who received peer-led services, there was a 28% increase in employment or enrollment in school and a 39% increase in stable housing. In Chicago, peer services reunited recovering parents with their kids, saving the Department of Children and Families $5 million. And then there are a couple of others like reducing the use of high-cost crisis services in Phoenix by 22%, and reducing and keeping recidivism rates as low as 5% in that last example there. And then some considerations for integrating peer recovery support specialists. So we would strongly advise that any agency that's looking at hiring peer workers should have proper supervision. This is really, really important. In Nevada, anyone supervising the delivery of peer recovery support services must be approved by the Nevada Certification Board. That looks like some additional training primarily. And then we also would say for sustainability and funding considerations, you should think about how is your program going to maintain these workers? So does that look like Medicaid billing through grants, fee for service, et cetera? Review your current recruitment practices and workplace policies and procedures. So think about, obviously you really want to start with a well-defined job. So job description, so then you can clearly have some role clarity between your peer workers and other members of your team. That is really crucial. So then there's no scope creep in the work that you're having your peer workers do. And also think about those recruitment practices. Where are you recruiting for your peer workers? And are you connected in the communities where you may be able to recruit for these positions? Understand peer competencies, ethics, and managing a team of people with lived experiences. I would say that one is really important as well. And I'll give you a quick example. At our organization, we have an internship program for peer recovery support specialists where peer interns go to Clark County Detention Center and they provide peer support to their peers who are currently incarcerated. And on paper, it would be great to have people with that prior experience of incarceration, but we also know that there's also a trauma component there, right? And not all peer interns who have that prior personal lived experience feel comfortable being back in those same environments. They don't want to do it. They don't want to be re-traumatized or be in those same environments. And so it's really important to understand that as an agency, whether it's an outreach program or something else, maybe in the emergency rooms or in the jails, you really have to, again, know who you're recruiting and listen to your peer worker team and don't put them in situations that could jeopardize them. You should have proper tools and templates available for your peer services, like understanding how are we going to measure outcomes, how are we going to provide observations of these services, how are we going to do performance evaluations, how are we going to do mentorship and supervision agreements, and create plans with our peer workers. And then agencies should also go through system training and team orientation once you hire your peer workers, so then you can introduce them to the rest of your team and introduce other concepts of recovery, peer support, and their role to the rest of your team members. And then we can go on to the last slide. So that essentially concludes the presentation, but I will leave everyone with one other point, and that is that, you know, in our state, we should continue to invest in peer support workers, but also in peer-led organizations that are fully run by peers. And whether that looks like recovery community organizations, here we have a map of RCOs across the country, where other states like Georgia have 8 to 10 RCOs that operate independently of one another. And in the state of Nevada, we only have 2. But there are so many other great peer-led programs here in our state. I know NAMI's one, Clubhouse International is another great example. I would say Track B is also another great, primarily peer-led organization. So continuing to invest in these vital services. And that's my presentation. So I can stick around for questions.
Thank you, Sean. That was awesome. There's a lot of information. Subcommittee members, do you have questions for Sean?
I do. Hi, this is Chelsea, for the record. Sean, are there any areas that you see that you believe that are kind of lacking peers, either, you know, peer-led organizations or peers being incorporated into organizations? Any things that may be able to help benefit like treatment and recovery in our communities?
It's a good question. I mean, I think that what we've seen over the past couple of years is actually more peer workers being integrated in different agencies. So that's been really exciting to see. I also had the opportunity to sit on the Nevada certification board, so we can see how many people are becoming state certified, along with supervisors and interns, and it's just been growing, you know, which is really exciting. I would say that there's more opportunities always to integrate people with lived experience because, you know, in addition to being able to provide better services for most agencies, I think that it really creates a good learning opportunity for our healthcare providers to be working, you know, side by side people that have lived experience. It just brings something to the team that, you know, you can't find if you don't do that, if you don't employ them and have them be a part of your service delivery team. A couple of the barriers that we run into, I would say, would be oddly enough, like legal considerations, background requirements of different agencies where they're like, listen, we just have this hard and fast rule of these are the different types of disqualifying things on someone's background that would lead us to not employ somebody. And shouldn't say most, but you know, there are a good portion of people lived experience that's part of our story, right? Is that we have, you know, criminal histories, if that's what you want to call it. So I think that's been a primary barrier too, is agencies say like, look, we would love to hire peer workers, but we just can't get a lot of folks that we want to hire past our background screening process.
Thank you, Sean. I have a couple of questions. One is related to that. So we're trying to implement this sobriety treatment and recovery team model, which incorporates a peer recovery support specialist, AKA family mentor, in a dyad with a caseworker to either not have children be removed from their parents, and this is just for parents with a substance use disorder, or if they are removed, to reunite them, to work towards reunification as quickly as possible with those added supports. In our Nevada revised statutes, there are disqualifying offenses for persons who work in child welfare that don't align with the peer bill. So that's one thing that I would say is a legislative kind of target. But so I guess thinking about diversity, equity, and inclusion and getting peers in all of the places, right? Tribal communities, just like thinking about our LGBTQIA population, et cetera. I guess, what are the strategies that Foundation for Recovery has been utilizing to recruit a more diverse peer workforce? That's one question. And then my second question is reimbursement rates. Like what, I guess,
Yeah.
what are your asks as far as like this committee? How can we help advocate for your asks for the peer workforce in our state?
Yeah, that's actually a really good question, Lisa. So I would say, I'll start with the latter question. I think one thing is really being able to stand up like peer services on its own 2 feet, as I don't want to say separate from, treatment, but I think so often these services get kind of looped in, because there's a lack of understanding. And, different agencies will say, well, we're, peer-based and we hire people with lived experience. But, you really should have, I would say, targeting, funding specifically for like peer-led organizations, letting the people who have been directly impacted by this, family members and individuals, have the resources so then they can go out and do, the incredible work that they're doing in their communities. Like our past presenter, Donald Griffin, I think that's a great example of that. And Darcy, Patterson up in Reno. And so I think being able to think of it, outside the box and really fund peer-led groups and organizations in the communities that have been historically excluded, left out, and just seen as consumers of these funds, and allow them to stand on their own 2 feet and go out and do this great work. So that's one thing that would be my one ask. And then the other question around creating a more diverse workforce of peer workers in the state. Our agency in particular, I mean, we facilitate at least 10 peer recovery support specialist trainings a year. And that's the first step towards certification. It's one of the first requirements. What we're trying to do currently is develop like a train the trainer program, because we don't want to be a gatekeeper of this information, right? Like for a long time, how the peer movement was born was based out of advocacy and grassroots. It was ex-patients and communities organizing, creating mutual aid networks when other systems and institutions had failed them and us, right? So we want to be able to continue to just give this information out where it doesn't have to be, employees of Foundation for Recovery leading these trainings, but let's teach other people how to bring the required peer support specialist training into their communities, whether that's the tribes or, other people's local neighborhoods. We don't want to be like the harborer of this information any longer. So that's one thing that we're working towards is a train the trainer program. And then our role would be to continue to provide ongoing support and technical assistance for all the trainers. So then we can just ensure that fidelity of the education is continuing to be met, right? And that it's quality education.
Thank you, Sean.
Yeah,
I had trouble finding my mute button.
Chair Lee, this is Steve Shell for the record. I don't have a question, but I have a comment to what Sean's just presented. I wanted to share that I have seen the tremendous results that our peer support team and our ERs at Renown have made in the last 18 months to 2 years. It's been phenomenal. And it's one that I hope that we can certainly continue. As you said, Sean, I thought it was a great comment. They've been working side by side with our ER physicians and nurses, and it has really helped open our providers' eyes, to a lot of these experiences. So I just wanted to applaud you in all of these efforts. I also wanted to share that we're opening a community crisis stabilization center later this year. Mm-hmm. And the biggest bulk of our staffing will be peer support specialists. So I'm very excited about that. So I would love to talk with you guys later, offline about all of this, but I just wanted to put that out there that we're opening that CSC later this year that will be primarily staffed with peers. So very excited to get that off the ground. But anyway, thank you for everything you're doing, Sean.
Yeah, thanks, Steve.